and then we're going to gather our supplies. You need, most of your facilities nowadays have IV start kits. If for some reason your facility doesn't have one, you know that you need a tourniquet, tape, a few 2x2s, and a tegaderm. What you also need to bring with you is you need a little extension. Depending on where you work, some places have an extension that has two little ports coming out. Some only have the one. This one's a single, but you need this. Every time, oh, she's here to do FTEs. Okay, we'll continue. I'll let her do, do you want to come back, or do you want?
Yeah, you want me to come back?
Yeah, can you come back in like 10 minutes?
Yeah.
Okay. So you need to get a cap as well. See this cap? So that one you're going to put here. Then, of course, most importantly, you need your IV catheter. Most places, I would say, I've never encountered a place where the colors are not universal. So anywhere you go, if you see a blue, it's a 22. I usually tell students to remember blue 22. Pink is 20, so that was kind of hard. Yellow is 24, and green is 18. So green and 18, blue 22 are kind of easy to remember just because they kind of rhyme. So if you're going to get blood transfusion, 20 gauge is the smallest we want. But if and 20 gauge is actually ideal for a patient who's going to be in the hospital getting a lot of IV fluids. 22 is good if your patient's just going to get IV pushes once in a while. It's not connected to continuous. Maybe it's going to get an IV antibiotic once per shift. So be cautious of the size, but at the same time, not all patients can accept a 20 gauge or an 18 gauge because they have spider veins. So it's all going to be based, but remember, those are the few things you're going to think about. Okay, what I need it for? What is the patient going to have? And can the patient actually support a large IV? 22 is nurse's most favorite because they're easy to go in as a smaller needle. Okay, so we've gathered our supplies. Of course, where I was gonna, this is hand sanitizer, okay? Okay, so I'm walking into the room. I introduce myself to the patient, explain to them why they need the IV, because a lot of them, well, I'm only gonna have this. They'll say, okay, but you need the IV, you know, explain to them the procedure. Let them know a lot of people think that your IV is gonna have a needle. Explain to them that the needle comes out, it's only there because if you put an area that bends, they're thinking that there's a needle in there. Let them know that it's only a catheter and you only need the needle for insertion purposes, but the needle comes out and it's a catheter. They're more than welcome to flex. They don't have to worry about getting cut. So we explain to that, and then we also provide privacy. Always close your curtain and see if they have any questions. Okay, once you get that, we know we have our supplies. So I'm going to assess my arm, and I'm going to make sure that things we're going to look out for. Making sure there's no AV shunts, making sure there's not a fracture. There's a lot of edema. Those are hard arms to go to, so try to get an arm that does not have too much edema, if that's an option. Also consider their non-dominant versus dominant. Whenever possible, try to avoid their dominant hand because you know they're going to keep busy, very likely to bump it, get stuck on somewhere. So try to go that route as well. So I'm looking at this arm and I notice there's no bruising, no AV shunts. So I'm going to go ahead and use this arm. So the first thing I want to do is choose my vein. So I'm going to put the tourniquet on. These mannequins, as you can see, they have been using drugs. We call this the IV drug user hand because he has a lot of pokes. So before you even put the tourniquet, you kind of want to see which one's a good vein. So I think he has some good hand veins. So I'm going to go here. You want to apply the tourniquet 4 to 6 inches from your desired location. And once you apply the tourniquet, you can ask the patient to maybe squeeze their hand. And you want to start looking to see what seems to be good. And I'm going to go ahead and I'm going to go with this one here. So I'm going to take my tourniquet off. You can leave it there. Take it off. Now you want to start preparing your stuff. So tape is always good to prepare beforehand because you only have one hand once you get your IV. So you're going to be working with one. So you want to get as much ready as possible. Your cap there. These are arrowhead style. Not all of them look like this. You want to loosen it up a little bit. Okay, so that's ready. Get this ready. This one's your skin prep. If kids don't have this, bring some alcohol with you. And since I've already touched the patient, I would have hand sanitized again before I start touching all this stuff. And obviously you don't want to touch this tip once you take it out. You still want to leave it untouched. You want to get yourself your flush. Get your air out. And attach. Flush your catheter. Make sure there's no air bubbles in there. And you want to loosen your end cap, because if you don't loosen your end cap, when you get your IV, this one here, you want to loosen that up, because once you get your IV, it's going to be hard to do this with one hand. So you want to loosen it and put it back in your pack. But even if it falls off, if it's back in the pack itself, it's still keeping it clean. Okay, so hand sanitize again. Put my gloves on. And you guys all know this is not a sterile procedure. Okay, I'm going to clean my site. These you pop. You're going to clean whatever side. I usually clean another one just in case, because you never know. You may not be able to get that one. Allow it to dry. And for demo purposes, I'm going to help it dry. Okay, so then put the tourniquet on again. Okay, select your needle here. You make sure that the bevel is up. You want to support the arm. You're going to go in at a 30-degree first. And then you're going to go down to 10-15, and you're going to wait for blood return. And these mannequins, unlike your real human, they're kind of tough. Even this one. I don't know if this vein is damaged, because this is usually my demo hand. I think this vein might be damaged. No, actually I got it. Okay, so you get flashback, turn the tourniquet off. Now you want to loosen this end cap, but you don't want to take the whole catheter. You want to push with your finger in, push in, and then hold some pressure here. Go all the way out. I like to grab a little 2x2, put it here. Lock this, and grab it here. Connect. Bring the patient up. Check for blood return. I got blood return. Flush it back in. And look around as you're flushing, making sure that your IV has not infiltrated. And a smooth, it should be smooth push like this. And remember I told you have your tape ready, because it's up to you. You can either put the tegaderm or the tape. If you get a really big vein, you're going to have flashback like that. So if you do, and you flush, and blood comes back again, get another flush and flush it again. You don't want to keep blood in your catheter, because it will clot your line. Okay? And our poor guy is bleeding. Usually your patient won't do that. So you want to date, time, and initial. And document. You're going to document the catheter size, patient tolerance, that you got blood return, and that it's not infiltrated or anything like that. Okay? That's it. Any questions? Pretty easy. If you've done this before, the only difference between this mannequin to a real human is that you actually have to go much tougher inside, because it's plastic. It's tough plastic. okay? And removal, simple. Just take the tegaderm off, let them know you're going to remove it. When you're practicing and he starts doing this, don't worry about it. I think it's just because we use them so often. And for these guys, we can only use 22s. That's why we're only supplied with 22s. The other catheters are bigger. The smaller the number, the bigger the catheter. See, it's just a little plastic catheter. Okay, all right, you guys, you all can have one to practice. If you feel very confident with your skill, you can actually get checked off on this today and you get another catheter to do this in, okay?